Everyone. How are you all? Hello to everyone. How are you all? So I'll be basically giving you a review of this exam. Plus I'll be discussing very important things, that where the questions actually came from, what are the source and how to get these questions. So it is basically an idea about all your queries regarding the exam, this exam and the future exam. All we are going to discuss in this session. Okay. So very now don't be sad. Okay. Whatever happened has happened. You cannot change the future. Okay. What you can do is, yes, we can, yes, improve the future better. Okay, so let's start. So first is, I'll give you a basic idea that what is the most important thing in terms of our preparation. Okay, so I'll just give you an idea that everything we do in NLC, or should be the idea, is this file. This 86 page file is one of the most important file. This is our PYT files, and it has almost 100 plus question asked from here. So I'll just give you idea. Okay, I'll give you. Okay, so I'll be starting. क्या बात है? Okay, Dr. Yash, congratulations. Okay, sure. Best of luck for your, yes, need PG preparation, and I wish you best of luck to get a very good score and always do well in your life. Okay. Yeah. Radhe Radhe Digamba bhai, and also Dr. Pashuthan, thank you very much for this review. The question did came. Okay, because this time also some people were saying nothing came from my session. I don't know where the question came, if nothing came from my session or other session also. Okay, so let's discuss the roadmap for FMG exam December 2000. Yeah, I'll share the PDF. Don't worry. We don't hide or put anything away from the students. We share everything possible. Okay. Yeah. Koni Jatin, I will try to solve your queries. Okay. Thank you very much for, because see, I'll tell you the secret of our NLC success is this. Okay. And our Q bank. Our Q bank is based on all the PYQs of NEET as well as the what? INICT plus FMG. So I will just give you what all questions were there and how they are formed and how do we decide. Keyword, like if you remember, I discuss questions, okay, and carcinode I discuss in this case. Why? Because if you take my PDF of the exam which I discuss, almost every question can come. Okay, clear? So that is, yes, going to come from important topics. Okay, so let's continue. Let's start. Okay, so first thing, what do we need to understand is self-belief. The most important thing is whatever you did in the past 5 years, forget past failures or lack of preparation, whatever. Okay, because first thing is self-belief that you can pass the exam. The result is improving if the person is preparing. So my only hello by Piyush. Okay, Jatin, I will tell you, okay, clear, in the end what is important or not. Right now I'm just going to give you what's needed. Okay, so first thing is forget everything about the past and focus only on one thing, that is the December exam. Will be most likely in the January. So very high chances it will be January, because they are maintaining now a pattern. It is exam is occurring in July and the January. Earlier it was June and December. Now it's been modified, so most likely will occur in the Jan. 20 Jan was the last time exam date, so maybe this time also 20 Jan. So we have approximately 6 months. Okay, or we can say 180 days. So my simple formula is, even you can do 1 MCQ per day. Study a topic from the subject, even if you are doing 1 MCQ per day into 180 days, you will get 180 and you will pass. So that is a self-belief, that is the power of thinking that you can pass the exam just by doing these number of questions. Okay, so are you clear? Second is, we need sincerity and discipline. If you really want, okay, no one can pass the exam without being sincere. No coaching, whether it is the best coaching, worst coaching, best app, no coaching, no classes, no teacher can make you pass if you are not sincere enough. So that's why it is up to you to give your hard work and this give the funda. Okay, are you clear? Okay, clear? Clear? So that is the case. Okay, fine. Now, not attending classes. Okay, not attending classes, biggest like crime. सबसे बड़ा पाप है अगर आप क्लासेस ही नहीं करते, because without classes how will you understand? Because you need to understand the concept. Without the conceptual learning you cannot solve. Then not finishing the syllabus. Okay, if you don't finish the syllabus and you leave lots of subject, so not finishing the syllabus is again a big crime. Not practicing enough test or question bank, again it's a big blunder. And looking for shortcuts कि सर इससे कर लूं उससे कर लूं, ऑब्वियस सी बात है, इफ यू टेक मोर एंड मोर शॉर्टकट्स इन द एंड आप ही का कट जाएगा. तो इसलिए इतने भी शॉर्टकट मत लो कि आप ही की लाइफ दिक्कत हो जाए. सो माय सेकंड रिक्वेस्ट विल बी, please give your 100%, and that is the idea here. Okay, now NB pattern, as you know, it keep evolving, keep changing. Now as per the recent, it is conceptual learning is a must. Okay, you cannot just mug up. Okay, so that's why avoid one liner, RR, chanting, or any kind of shortcut as the main source, especially for major subjects. So are you clear? So that is our important concept. So if you are doing main subject like surgery, OBG and medicine, and you want someone to give you 10-20 hours of surgery, तो again you are making fun of yourself also. ये 20 घंटे में सर्जरी नहीं होती यार, क्या पढ़ लोगे 20 घंटे में? नेम ऑफ द सर्जरीज मे बी सम इम्पॉर्टेंट, बट इन द एग्जाम आजकल ऐसा नहीं आ रहा है यार. Full questions are applied question, management based question. कि patient come with this symptom, then he had this, what do you do? If you don't understand, I'll give an example later how to approach the question. This I'll discuss later, but right now just tell me, can you solve the question without understanding? No, no. So that's why avoid one liner in the beginning. And what is a must is previous year questions and PYTs are a must. If you're not doing the previous year question, it's a big blunder. I'll show you how important they are. So have a look at this question. Okay, so this is our PDF I'm showing you. This is our question bank, NLC question bank. NEET PG 2019 questions are there, and in physiology I will open the physiology paper preview. So in this I will be opening the questions. These are question number 18. So I just put it on your screen. 41% answer correctly, only 41%. Which of the following ion is responsible for hypoxia sensing? This was this year exam question. Okay, so this was our Ankit. It's up to you. The content is same, but only thing is we prepare mainly taking into view the basic concepts. Okay, so there was some of the topic, so the concept we skip in FMG classes. Okay, so maybe you might find the content slightly less, like 80-100 ratio, like 80% 70% of the content which is taught in PG classes might be there in FMG classes. So yes, slightly content will be less, questions are same. Okay, so which of the following, yeah, it is for upcoming FMG exam. So this question came in the recent exam and lots of people mark as potassium or sodium or calcium. Answer is potassium. Answer is potassium, and this was, yes, this was the question, which ion will, if they are asking inhibit, okay, clear, then the answer should have been chlorine, because chloride channel inhibit them. Okay, so then the answer will be chloride. If they are just asking which ion channel is, yes, then it is potassium. So potassium cause the AP by closure. Okay, Akanksha. So it's a PYQ. Again, it's a PYQ. Then second I will give you is this one. So this I've discussed already, PYQ. Then this question came in 2023 January, last year January. This question was there, that is Geisbach syndrome. Again, it was asked in this year again. They gave a hypertension patient with obese smoker and asked what is the, yes, true about this syndrome. So again, this is again a PYQ from our Q bank and it is there. One more I will show you. So this is the file of our PDF of all the PYQs, and if you see carefully, I will show you. The Hartnum was asked 2 times in the recent exam. So one, it was asked here, the Hartnum, okay. Second, it was asked, see Hartnum. It was asked once in December 2020. Then it was asked in December 21 also. The Hartnum was asked. So twice it has been asked in the exam. Okay. Then I will open directly the first page. So this is our PYT books. Okay, NLC. We collected after lots of hard work, and this is what I am trying to give you. This was the question asked in our this posterior tibial nerve. They ask, and this was again asked in this year exam, that is posterior tibial nerve. Also they asked this renal ligament. This is a posterior tibial. So this was again one of the question which was asked in the exam in 2024 June, July, and this was a question from December 2021. So that's why I'm telling you, yes, what is the importance of doing PYQs or PYTs. Don't just do PYQ. The reason, if you just do PYQ, you just know the answer of that question, but sometimes they don't give the same question, they give the, yes, complete concept from that particular topic. So that's why my request is this again. This time they asked Prader-Willi, but they have already asked almost all. This Patau syndrome was also there, again it's a PYQ. So that's why my simple request is please, 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 this question was again PYQ, lino-renal ligament. So those who gave the exam, yes Akanksha, it was there, lino-renal ligament identification. Again they asked cystic artery also. Again they are all basically from the PYTs and PYQ. So that's why this file become very important for those who are preparing for the exams. Then regarding the clinical subject like surgery, OBG, now you need in-depth study. Don't use old material or what is not updated. So need updated content, especially with clinical algorithms. So they are very, very important. If you are not doing them, it is going to be a major blunder. Like flaps. This exam they ask lots of flaps. If you're not good in understanding, they will be a problem for you. So my again request is please do surgery, OBG very well. Otherwise you will again be criticizing the faculty that they are not covering. It's up to you to cover in depth. Okay, you can ask them or they can update so that we get a proper understanding of this, which one is used. Okay. Then next question is, what was the earlier pattern? Like they will teach you or you learn, like in revision, chanting, one-liner, we learn drug of choice of PSVT adenosine. Now this is not sufficient. Now not sufficient. Earlier it was sufficient. Now it is not. Okay. So we are updating. Yeah, it is same. Okay. Yes, Krishna, it is same. Class Plus NLC app is same. Okay. Obviously because we are having same but in two different what to say modes. Now second is, it is not sufficient. What do you need to know? You need to know first what is PSVT. It's a what? Ventricular tachycardia. then it is the rate more than 100 per minute, P wave is absent, plus there is narrow QRS, then could be AVNRT or yes AVRT. Clear? So you need to know in depth. Then diagnosis, how to make a diagnosis. So obviously we need to know the narrow complex all. Okay, then what is the cause, what is the full form? Management. Now management needs not just words, we need proper understanding. Ki what is the management? I'll give you an idea. For PSVT, this is the criteria. They are PSVT. First, we need to know whether patient is stable or not. What is stable means? BP. If BP is less than 90/60, he is hemodynamically unstable. Drugs are useless. No drugs. We have to go for cardioversion with our low energy synchronized DC shock. So we'll give the DC shock. Synchronize. And if patient is stable, we will first start the Valsalva. What is Valsalva? That is vagal maneuver. That is carotid massage, carotid stimulation. We do a carotid massage. So again, I'm telling you how to approach. And if it is still not able to correct the PSVT, so earlier it was sufficient to identify PSVT or the name the drug of choice. Now you need to know proper. Now if still PSVT is there, then we can give adenosine first. So drug of choice is adenosine. Okay, but problem, if patient has asthma, we go for CCB verapamil. Asthma verapamil. So now the answer changes to verapamil if he is having asthma. And for prophylaxis, again we can go for CCB. CCB. So you need the prophylaxis, CCB is the answer, CCB. And finally, if still no response to drug, again cardioversion. Not responding to drugs. So that's why all our NLC Q bank is based on the algorithm and the PYTs. So we are explaining each and every topic with explanation, with NEET PG question also and INICT. I'll just show you. So not just NEET PG, I'll show you our updated Q bank. So what are we using? So this is our NEET PG. I'll just show you how many questions are there. So first there's questions of each subject, topic wise, anatomy, biochem, topic wise. Then there is PYQs of July, all are there, Jan 2024, all are there, okay, Jan 2024, plus PYQ book is also there. In the PYQ book, all the topics are arranged and there in the book form also. So if you want a PDF book, you can get it in the app itself. You can see. So these are all our PYQs which I am discussing. क्या बात है बिलाल, how are you भाई? चलो यार, you will pass, you will do your well and my best wishes. So this is our PYQ book, okay. This was the question asked in this exam and it's a 2020 this, okay. Posterior tibial artery. Are you clear? Clear? Then this ligament. So I'm telling you, okay. So this is what I am telling you, that lots of questions, again this was asked twice. So again PYQs are asked in number of times in the exam. So this is there in our Q bank, full this is there, okay, with explanations, proper explanation of each and everything is there. Then apart from PYQs, it contains the mock test. 21 mock tests are there. If you want, I can open and show you. So I'll open it later. So these contain our PYQs, okay. Clear? Then it contains subject wise tests. So each subject we have 2 tests, so 30 tests are there. Some have 1 like small subjects. Then clinical image based, like image based mock. Then there is what? Also there is ECG, etc. Then test and discussion. All subject which are there, they contain their test also. Like example, you are giving a medicine test, then you can watch the medicine TND which I took. So that's why you'll be able to see the explanation of the question also. So that's why good thing is you give the test and after the test you can check the description of the in the video, okay. So I was just discussing it. So again I'll show the content. Second, apart from that, there is also NEET PG PYQs, okay, chanting videos are there, new mock test, ionized CT is also there. So we are the only one which contain ionized CT, all the ionized CT, May to 22 December, ionized CT November, all the ionized CT papers are also there. So we use it for preparing our content, and that's why our content is very effective. Are you clear? Now, if you know this, try to solve the question. So this is the final version. So stable, yes. Not stable, cardio version. Low energy DC, synchronized shock. Then if BP is stable, we decrease by vagus nerve, that is carotid massage. Then if there is contraindication adenosine like asthma, give CCB, verapamil, otherwise give adenosine. If still PSVT persists, then we can go for verapamil, and if it fail, we go for PSVT. So now we can solve the question. So can you give the answer? What is the patient of hemodynamically stable PSVT? What we should do? What is the answer? Give the answer. Yes, we'll go for Valsalva. Why? Because we never do a cardioversion in such a patient. It's stable. Okay. What is stable means? BP is more than 90/60. That is how we teach, by proper algorithms. Okay. Yes, Krishna, you are right. Next question. If BP is low, what should be done? If BP is low, tell me what should be the response and what should be the case if BP is low. Cardio version, very good. We go for cardio version. What is the drug of choice for PSVT? Drug of choice. Krishna? Akanksha? Nobody? Riya? Ankit? Jatin? Adenosine? What will be used for prophylaxis in a patient with PSVT? Yes, you are right, Dr. Vishwash. What do you use for prophylaxis? For prophylaxis. Yes, we will use CCBs. So that is how you solve. And what is used in patient of PSVT with asthma? Yes, verapamil again. So that is how you get. So now make a plan. First plan is 150 day. All 19 subject should be done properly. Okay. Proper class. Or if you're not doing class, main videos. Don't watch RR from the beginning. Then you will be regretting it because we could not. Physio people don't study at all. And then when the question come in physio, they don't even know it's physiology. Reason, they don't study. And that's why I'm telling you, please do it properly. If you're ignoring, it's going to be a problem. Okay. Then we need a revision day. So that's why after your syllabus is over in 100 days, so that is around 100 days. 50 day we take for revision. Test series QBank is very source. Now regarding the source, I will, if I ask, offline is far better compared to online, and online is better than recorded app. Reason, it is very old lectures, not updated. Live class, so it's a live class, interaction is there. And offline is basically, there's a FOMO. What is FOMO? If you miss the class, you cannot watch it. In live, you can still watch it later if you miss the class, but in offline, you have to be there in the class, and it's not sleepy because you will be there attending, writing. So offline has the best. The fear of missing out, that's why the best mode of study is offline. Anyone will vouch for this. If you have to meet someone, what is the way? They send you a recorded message, they call you and talk to you on the phone, or they come and meet you. What do you say? Your parents meeting you, your parents talking to you on Zoom and whatever, or your parents sending you message? What is better? Obviously, offline is far better. It gives you best possible feeling. So mode, I tell you, self-study only possible if you are very sincere. Only if very sincere, disciplined, and willing to study without any gap and study 8 to 10 hours daily. So then though it is fine. So it is 8 to 10 hours daily. Then fine. Classes, I told you, you can do app, you can do online, offline, is up to you. All are good if you are good. Clear? If a student is sincere, even textbook notes can be sufficient if they are good. If they are not sincere, then though nothing will work. I've seen people fail attending offline class also. I've seen people pass just doing the, yes, some of the videos also. So it's up to you, okay? Now regarding the advantage, so I can tell you recorded is not fresh, whereas live class are better because you interact the faculty. Cost is much cheaper, it's 15-20K, okay? You can do it NLC and other apps also, they're giving live classes. It's very expensive, 30 plus is the app recording. Plus it is FMG oriented because the teacher will teach you as per your understanding and your level, not as per, like you don't differentiate. The NEET PG content is slightly deeper. Clear? Because they assume you already know basic level stuff. Like when I teach in NEET PG, I know the student already know the basic stuff. They know sodium channel, potassium channel, receptor, this. So it can directly start with the sodium channel blocking agent or opening. Here I will have to explain first what is sodium coming inside, where sodium more, what is the sodium entry will create depolarized hyper. So that's why it is FMG oriented. Plus we already have a victory Q bank there, is very this. Plus revision, I think best is 7 times. If you can do 7 times, it will be the best. Plus obviously you have syllabus done on time if you attend the classes, and then you can do revision, TND, RR, everything. Plus TND is there, test and discussion, which is very effective. In the end, faculty discuss the answer and that help you solve your queries there. And past person is always better, that's the case. So you can attend NLC also, okay, for the exam, okay, and faculties are there which are very good. So whatever your queries are there, you can tell me. I will now take your queries. I've already discussed whatever is there. So whatever queries you have, you can ask me, I will answer. Okay. If anything, yeah, it did came, and I told you it is again from the previous year exam question. I can show you, it is there in the book also. Where's the book? So it did came, so it's not something new, it did came. Online timing is 11 AM, okay, till 7 PM. So around 8 hours daily. Okay. Fee structure is obviously slightly more for offline. Offline is 40 to 50K, depending on which coaching you want to attend. Some coaching fees can be 80K also. Online is cheaper. Online is 20K. App is again 20-30K. Okay. So batch Krishna, already it is starting. Okay. Already tomorrow we have online class. First physiology class tomorrow, online and offline. First physio class, online and offline. And then new batch will start from the 10th, 15th, 20th July. So you can attend the classes from 10th, 20th. Okay. So fee structure, I told you, offline is 40 to 50 depending on group discount, bulk discount. So 40 to 50 is offline and online is 20K. Online is 20K. So yes, it is 20K. Yeah, after result also we are waiting for the result. Once the result come, we can start the new session from the 20th of the July. Otherwise, we are just doing the subjects right now because currently students are studying, so we need to do classes. जो पढ़ रहा है उसको तो पढ़ाओगे ना, ठीक है? And offline faculties are a bit different because some of the faculties of apps, they cannot take online class, so that's why online faculties are different. Like example, online we have Dr. Puneet Bhojani, very good faculty for OBG, but in offline we have Dr. Prasanna Vich. So that's why the faculties can differ in online and offline. Okay, thank you Dr. Kiran. Okay, yeah, I am trying my level best to help you all. If you want anything, we are there for you. Okay, I'm just waiting for the result. Last batch for this we will start on 1st of August, because after August we cannot make any batch. It's almost impossible. Maybe up to 5 we can extend, but it is 1st of August, because we need at least 5 months to finish syllabus and do revision. So if you start a batch in mid-August, it'll be difficult to finish. So don't want to do that. That is our only issue. We will be doing it in this case. Are you clear? Okay, Medico? Yeah. Thank you very much, Dr. Vishal. And don't worry, you are going to do well. Okay, clear. Result will be good, 40%. I was the only faculty who said the paper would be PYQ based. Clear? I said now, government, you can watch the lecture. I said in the beginning, paper will be PYQ based. Please do PYQ, PYT. मैंने बोला था आपको starting में. Second, I said 40% के आसपास result आना चाहिए. 40% result, close to 40, and that will be there. Okay, चलो. Yeah, hostel, everything is there. We have a campus offline. We have full campus with Wi-Fi, food, AC, all. So AC, Wi-Fi. There's mess system. You can join mess or you can take canteen. It's up to you. Is all, and it is just next to NLC. So like NLC classroom, this is our hostel next to each other. So don't have a gap. It is same location nearby. Okay. Yeah, you can join online, Krishna, no issue. Okay, so just a message at this number. Okay, this is my number. I'll myself personally help you. So this is my number. You message me, I will add you to online batch. Once you come to Delhi, you can join offline. We are very open to everything. We just want students to study sincerely, but please only join NLC if you are sincere enough to study. If you are in the mood of attending some class then leaving, then there's no point. Okay, because I don't want anyone to fail after attending from NLC. So that's why I want everyone to attend classes, only then join. Okay, okay. Yeah, I tell nothing. Okay, the changes will not be affected in terms of pattern. The pattern will remain the same. The question will again be asked from this file. ये फाइल ही है आपके सारे क्वेश्चंस की कुंजी. If you trust me, you can check this file and you will get almost all possible questions in this file. Okay, large number of questions are there in this case. Okay, biochemistry, almost this year also they ask you lathyrism, boa. I can just click the search button and I will be able to get the questions in this case. See, so that's what I'm telling you. Okay, almost all the important topics which are there are must, and that's why our teaching is based on this book. Whatever they like, this again they ask you best agent. Again, this was a question this year. Those who give the exam, they will say propofol was asked as the best agent. Propofol was asked. Okay, yeah, hybrid mode. Again, what are you asking, Vishnu? Regarding what you are asking, classes? Yeah, you can do anything. I don't mind. Okay, if you want to attend online, offline, it's up to you, but I will prefer you to attend offline as much as possible, because at least I can see you people and I can at least ask you whether you are studying or not. क्लास में दिखता है बच्चा, थोड़ा सा सिंसियरिटी रहता है. अब वो बच्चा नहीं आ रहा तो मेरे लिए मुश्किल होता है. सो आई प्रेफर ऑफलाइन. ऑनलाइन ऑल्सो इज गुड. इट्स अप टू यू. इट्स योर लेवल. वही बात है ना, आप कितने सिंसियर हो. इफ यू आर वेरी सिंसियर, यू डोंट नीड कोचिंग ऑल्सो. यू कैन पास विद वट एवर वीडियोज यू वॉच. ठीक है, चलो. एनी अदर डाउट यू कैन आस्क मी. आई विल एंड द सेशन. एनीथिंग एल्स? So again, best wishes to those. Okay. Yes, Vishal. This time, yeah, that's agree. I said na, paper 1 is non-clinical. So you can expect lots of bilateral in paper 1. Paper 2 is clinical, so they will be asking you mostly, yes, applied questions. So that is the case. Okay, chalo. So thank you very much. I'll end. Thank you, Krishna, and everyone for attending. My best wishes. Result day, we will have a big blast. We'll be having a grand celebration of the result. So best wishes to everyone. And I wish all of you do well and be successful. So best wishes for December 1st the results and December exam students. Chalo. So take care. Bye bye. Let's see you in the class tomorrow. So tomorrow class will start at 11 a.m. If anyone want to attend, they can message. We will add you. Okay. See, there's no chance of next occurring anytime soon. There's a new health minister. He will take time to look at the file, then decide. Even the Indian government medical college students are not willing to appear for next. Reason is it affect their future. Reason, they are able to prepare properly for the next. Now, if you become a part of final year, they have to have, like extreme pressure in their final year, and now they will not even attend posting. So it's going to be a, like sometime everything which is good intention end up with bad intention in this case. So that's why chance here. Okay. So again, I will tell you the results will come within 10 days. So that's why it will be before 16th of July. Okay. So within 10 days, because whenever they give a good result, it come within 10 days. If it come after 10 days, maybe not a good result, maybe 30% of this, but I am very much sure. See this, it will be before 20, that's for sure. Before 20 July. Okay. Chalo. So take care. Bye bye. Okay. Yeah, love you all. Okay, work hard. Okay, take care. Bye bye.